Hello, welcome to yet another episode of Dr. Sin. This is me, Naina, with you. Today we have with us Dr. David Tauro, who is a specialist in facial surgery. Let us welcome him to the program. Welcome, Doctor.
Thank you, Naina. Thank you very much for this invitation.
Before going further to the topic, we would like to know more about you, Doctor.
Well, I'm basically a cranial maxillofacial surgeon. I run a Center for Cranial Maxillofacial Surgery in Bangalore. In fact, I operate with several hospitals in Bangalore. To name one or two is Vikram Hospital and Mediop Hospital in Bangalore. I also work as a visiting professor and consultant surgeon to one or two hospitals in Hyderabad, Mysore and Bangalore. And I also have an academic attachment as a visiting professor to Hyderabad in one of the colleges, another college in Bangalore, so I visit several colleges as a visiting professor. I operate and I teach students, it's my passion. And in Bangalore, I run the clinic for craniofacial surgery, which deals with basically facial surgery.
Doctor, what is craniomaxillofacial surgery?
Craniomaxillofacial surgery is essentially a branch of surgery of the allied specialties of the head and neck. It deals with surgery of the face, head and neck, and predominantly surgery of the mouth, the jaws, the skull, and the facial regions. When I say that, it has got several subspecialties and branches. Craniomaxillofacial surgery per se deals with so many issues of the face. For instance, a craniofacial surgeon deals with accident victims of the face. He also deals with developmental deformities of the face. He also deals with deformities because of accidents or something like that, which are acquired deformities. We also deal with anything to do with the face, oral cancers. We also deal with joint surgery. We also deal with cosmetic surgery of the face. We deal with rhinoplasty, what we call nose surgery, cosmetic surgery of the nose. And we also deal with scars of the face. So we deal with a whole array of things of the facial region. So essentially, it encompasses the whole spectrum of surgery of the face. There's an area of what we call orthognathic surgery also, where we deal with deformities of the jaws. If somebody has a jaw deformity, we can correct those jaw deformities. So craniomaxillofacial surgery has a big spectrum of procedures that can be done on the head and neck and the face.
Doctor, what is the scope for this specialized surgery?
This is essentially what I said. The scope revolves around all these areas. We deal with oral cancer victims, we deal with trauma victims, we deal with patients who come for cosmetic surgery, we deal with oral cancer patients, we deal with, as I said, deformities again of the face, which can be acquired or they're genetic. So that's the scope of this specialty. And it's a very interesting specialty of the head and neck. It's a well-established specialty in the head and neck, other than these other specialties that are available like neurosurgery and ENT and other things. This is a very specific specialty which deals with so many areas of the face. And it's a very interesting field, particularly.
Doctor, is your practice restricted to a specific area?
Well, essentially I'm trained in all these areas of surgery that I mentioned to you. But in practice, I restrict myself to more of cosmetic surgery of the face, essentially deformities of the face. So I deal with correction of facial deformities. I also deal with deformities as a consequence of any of the reasons that I mentioned, be it genetic causes or even acquired causes. So any deformity of the face that comes to me, it can be a deformity of the jaw or the deformity of the entire face, deformity of the nose, or deformity of the entire head and neck. Sometimes we also get something called syndromes. And we have children coming with different types of syndromes like Down syndrome and things like that. So I deal with all sorts of deformities of the face, more so in practice. but in my academic setup, I deal with more or less all these areas that I mentioned earlier.
Doctor, how do you correct these deformities?
Now, the correction of deformities, it differs from patient to patient because there are several factors that need to be considered when you are correcting these deformities. Now, if you have a birth deformity, like for instance a cleft lip and palate deformity, a cleft lip and palate we correct at the age of 6 months, and the process is on from 6 months till the patient is about 20 years old. So it's a prolonged process. It takes a long time for correcting this deformity because there are certain things that we do in stages. So for instance, if you're doing this, it takes so much time. But then there are certain deformities that can be addressed, differently. Now, if you're talking about an accident victim who has got a deformity, that needs to be corrected probably immediately, and it is best done immediately. So all these deformities that we see following an accident, we need to correct them immediately. Also, we get deformities that are presenting with a deformed jaw or something like that. These deformities sometimes require a two-stage procedure or something like that. And then we also use what we call orthodontics for correcting the teeth. So there can be crooked teeth if you have to move the jaws. And then it is done on a joint plan with the orthodontist. So we correct this in 2 stages, 3 stages, and things like that. All these procedures, incidentally, are done through the mouth. You can actually change the face completely through the mouth. We can cut the facial bones through the mouth and change the face completely. You'll be surprised to see that we can change the face to a large extent and change the identity of a person. So any deformity can be corrected these days.
Doctor, are these procedures done under local or general anesthesia?
These procedures can be done under local or general. It all depends on the type of the case, the type of the problem, the nature of the problem, the duration of operation, and things like that. If you're dealing with, let us say, a simple scar of the face that has to be revised, what we call a scar revision procedure, some of these simple scars can be done under local anesthesia in an outpatient setup. So we can do this procedure under local anesthesia. It might take even sometimes from half an hour to 2 hours, and still can be done under local anesthesia. But if you're dealing with something called a major deformity of the face, whichever the deformity is, these procedures have to be done under general anesthesia, and it definitely requires hospitalization. So these are procedures done under general anesthesia. Some of them will be staged, some will be done in one go, and we have to admit the patient. It's like any other operation. We have to admit the patient, do also a thorough preoperative workup of the patient. Like any other operation, we do all the blood tests and things like that. So all that has to be worked up for the patient. And then it's a procedure under general anesthesia. It might take from 1 hour to even 7, 8, 10 hours, depending on the nature of the operation and the nature of the deformity itself. So there are some procedures that extend even 10, 12 hours. So these procedures definitely have to be done under general anesthesia. And the duration of hospital stay could be anything from 2 to 4 days or 2 to 5 days.
Doctor, how many operations do you need to do to correct these deformities?
As I said earlier, it all depends on the nature of the problem. Sometimes, even a very complex deformity can be done in one single stage. The duration of the operation might run to about nothing less than 6 to 12 hours. So that is the kind of operation that one needs to do for a very complex deformity. And however, even if we do sometimes do these procedures in one single stage, there are also might be something to be done at a later stage as well. Because if it is a very complex deformity, then it might need what we call a touch-up procedure, where we do maybe smaller procedures subsequently. So it all depends on a case-to-case basis. So some we do under local, some we do under general, some under local initially, some of them under general later on, some of them under general in multiple stages. For instance, we have sometimes when we have patients with burns, for instance, facial burns. We do get a lot of patients with facial burns. So correction of these requires sometimes multiple stages. We can't correct these cases with one stage procedure. There are patients that I've operated more than 10 times, 10 to 12 times. I still have a patient who comes to me for an operation. He has had an injury in childhood, and I've been operating on him in multiple stages, and he's still at it. I think he's already had his 10th or 12th operation. So it could be in multiple stages.
Doctor, does this surgery produce any scars on the face?
That's a very interesting question, actually. There are several procedures that can be done through the mouth. This is what we call skeletal surgery of the face. When you're dealing with soft tissue surgery of the face, we have to make an incision on the face. Particularly if you are doing, let us say, scar revision surgery, you are doing a procedure to minimize or eliminate or camouflage, we call, to mask that scar. So that's surgery that is done on the skin. So for such procedures, we have to put an incision on the face. But that is put in such a way, there is a specific design, direction for putting these incisions. So we make this incision in such a way that those scars are, as I said, eliminated or camouflaged. So that is when we are dealing with scar surgery. Now, if you're dealing with, let us say, nose surgery, nose surgery is completely done and can be done completely by an incision through the nose. So we just make an incision inside the nose, and you can actually change the nose completely. So you can make these wide noses narrow, wide tips narrow. If there is a wide nose at this base, we can narrow that. We can lengthen the nose. We can increase the height of the nose. We can do so many things with the nose, and all that can be done through an incision inside the nose. So you will not see any scar on the nose or the face. Now, for instance, if you have what we call a skeletal deformity, which means to say a deformity which arises because of a deformed skull or a facial skeleton, we call. So if it is a deformity arising from the bones, that is a skeletal deformity. And if that happens, we can actually correct that deformity by making an incision in the mouth. We can make incision in several areas of the mouth, particularly behind the lips. And we can completely do the procedure, the operation through the mouth without an evidence of a single incision on the face. So it does not produce any scar on the face at all. So you can actually transform an individual, change the identity of the person just by making an incision inside the mouth and move the jaws, move the cheekbones. You can do anything with the face through the mouth, believe it or not. And also we have an incision that we put on the skull, on the scalp as we call it, and then we can peel the skin of the head and the face all the way down to the nose, and all this upper part of the skull can be reshaped completely. And then the lower part of the face can be corrected by putting an incision inside the mouth, where we can correct the jaw, the upper jaw, the nose, and all these areas. So you have cuts only inside the mouth, and if required, a cut here. So this is covered by the hair, and you have an incision in the mouth which cannot be seen. So actually it does not produce any scars at all. So this is the magic of this kind of surgery.
Doctor, what is the approximate cost of this surgery?
Now the cost of these operations varies drastically. Uh, there's nothing fixed about any sort of an operation because it depends on the hospital's setup that we operate in. It also depends on the type of room that the patient takes. But an approximate cost can be given to the patient nevertheless. Let us say a simple scar revision surgery might take anything from $1,000 to $2,000 if you're talking in terms of dollars. But if you're talking about very complex procedures, there can be a big range. Now, I cannot give you, if we're talking about a deformity of the jaw, for instance, a single jaw surgery we call it, this particular surgery might cost roughly about $5,000 for a single jaw procedure. But when we deal with deformities, we sometimes deal with complex array of problems. So we might be dealing with multiple procedures. And if the surgery runs more than 7, 8, 10 hours, obviously the cost of surgery also escalates. So to give you a rough idea, if it's a correction of a deformity, it might be ranging from anything between $5,000 to about $20,000. You're talking in terms of dollars. If you're talking, for instance, cosmetic surgery of the nose, again, this nose surgery might cost you anything between, let us say, about $5,000 to $10,000. So that is an approximate range. So you could think about the range between $2,000 to about $20,000. That would be the approximate range.
Doctor, how many operations you have done till now?
Oh, that's a very difficult question to answer. Nevertheless, I think I've been practicing for probably more than 20 years now. I cannot give you the actual figure of how many I would have done, but I would have done several thousand operations by now. And we do get a lot of patients because my interest does not lie only in facial cosmetic surgery, as I told you. I operate on the variety of the cases that I get. So, I attend to, other than cosmetic surgery patients, I also attend to cancer victims, I attend to accident victims, and I also do other surgery of the joint and things like that. So, since the spectrum of my work is pretty wide, I think the number of operations that I do is a huge, phenomenal number. And since I've been practicing for more than 20 years, I think it runs into several thousand operations actually.
Doctor, how many people opt for this kind of operation?
See, if you're dealing with exclusive cosmetic surgery patients, I can say that it's surprising to know that today people are very conscious about their appearance, unlike the past. So we do get surprisingly a good number of patients for facial cosmetic surgery, particularly the younger group, and surprisingly even the older patients and older people nowadays come for this kind of an operation. I have dealt with patients even at the age of 55, 60 who has come for cosmetic surgery of the face to get a facelift done and things like that. So we do get a lot of patients, and if the patient apparently has a deformity of the face, he has no choice but get the operation done. And when they know that this particular service is available, it is possible, he'll definitely go in for it. When you're dealing with purely cosmetic procedures, then the number of patients may not be as large compared to patients with deformities. But still, we have a good percentage of patients who come for cosmetic surgery alone. Now, if you're talking about patients who have an obvious deformity, like a protruding jaw or a twisted nose or a very wide face or things like that, such patients, when they are aware that this can be done, we do get a lot of patients, and I get a lot of patients on the internet who inquire for this kind of surgery. So there is a huge number of patients who actually come for this kind of operation these days.
So, doctor, thanks a lot for being a part of our program.
My pleasure. Thanks very much.
So that was Dr. David Tauro with us. Until we see next time, this is me, Naina, signing off.